Hello, my viewers. How are you today? It's me again, your daughter, your little girl, your sister, your daughter, your everything, your friend, Aunty Abidoc. I'm just here again to bring another disease to us. This time around, I'm coming to discuss a disease called thalassemia. Thalassemia. Previously, we discussed about sickle cell, but today I'm going to clarify what thalassemia is, um, what what the condition is, what one can do to maintain it. So we're gonna have a lengthy discussion about it. Okay, so what is thalassemia? Thalassemia is an inherited condition that affects a substance in the blood. I'll say that again. Thalassemia is an inherited condition that affects a substance in the blood. And this substance is called hemoglobin. So people with thalassemia produce no hemoglobin or too little hemoglobin. If you can remember from our previous discussion on sickle cell disease, hemoglobin is used by red blood cells. It's used by red blood cells to carry oxygen around the body. So, producing no hemoglobin or too little of it makes the person suffering from thalassemia to become very anemic. So they become so tired, they look pale, they have shortness of breath. So, who does thalassemia affect? Who does it affect the most? Okay, there are one, people of Mediterranean, people from South Africa, from South Asia, and the Middle East. And we have different types of thalassemia. And these types are alpha thalassemia, beta thalassemia. Please note that beta thalassemia major is the most severe type of thalassemia. And the other type of thalassemia include one, beta thalassemia intermedia, alpha thalassemia major, hemoglobin H disease, thalassemia carrier, or thalassemia trait. So, people with thalassemia carrier or thalassemia trait do not have any serious health problems themselves, but they are at risk of having children with the condition called thalassemia. So, the symptoms of thalassemia are as follows. Majority of people born with thalassemia experiences problems from a few months after birth. Less severe cases may not be noticeable until later in childhood or even until adulthood. So, what are the problems associated with thalassemia? The main problem associated with thalassemia are anemia. These people become anemic. They have severe tiredness. They feel fatigue, weakness, shortness of breath, noticeable pounding, irregular heartbeats, palpitations, pale skin, which is caused by lack of hemoglobin. Then again, they can have excess iron in the body. This is caused by regular blood transfusion used to treat anemia, and it can cause problems with the heart, the liver, and hormone levels if left untreated. So, what are the Causes of thalassemia then. Thalassemia is caused by a faulty gene that affects the production of hemoglobin. The child can only be born with the condition if they inherit these faulty genes from both parents. Let me use an example to clarify this. For example, if both parents have the faulty gene that can cause beta thalassemia major, there is a 25% chance of each child they have been born with the condition called thalassemia. Let me say that again so that I can be clear. I can clarify that. So let me explain again with the example. If both parents, married or unmarried couple, have the faulty gene that causes beta thalassemia major, there is a 25% chance of each child they born together having that condition called thalassemia. The parents of a child with this condition are usually carrier of thalassemia. Remember, thalassemia carried means they only have one of the faulty gene that causes the condition. They are not necessarily suffering from thalassemia themselves, but they are only a carrier of one of the faulty genes. So, how is thalassemia inherited? Okay, gene comes in pairs. You inherit one set from your mother and one set from your father. So, to be born with the main type of thalassemia called beta thalassemia, a child has to inherit a copy of the faulty beta thalassemia gene from both of the parents. So the child will have inherited the faulty gene from both of the parents. So people with thalassemia have a problem with the gene. So this usually happens when both parents are carrier of the faulty gene. And this is also known as having the thalassemia traits. Not necessarily a thalassemia, not necessarily the thalassemia condition themselves, but they only have the traits. So another type of thalassemia called alpha thalassemia has a more complex inheritance pattern, because this particular one involves 4 potential faulty genes rather than just 2 in the other thalassemia that we mentioned. So children of parents who are carrier for alpha thalassemia traits will be born with the condition if they inherited 3 or 4 copies of the faulty genes. So children who inherit 1 or 2 copy will only be a carrier. Remember, we are now talking about alpha thalassemia. So, how to find out whether or not you have thalassemia? How can somebody find out? A simple blood test shows whether you are a carrier or not. And this is done routinely during pregnancy and after birth But you can also ask to have the test at any time. So, how thalassemia affects the body? Your genes are the set of instruction found inside every cell in your body. They determine characteristics such as color of the eye and then color of the ear. People with thalassemia have a problem with the gene involved in the production of hemoglobin. Okay, so what are the treatments? Well, the main treatment is regular blood transfusion. Regular blood transfusion. Remember, people with thalassemia major or other severe type either do not produce hemoglobin at all, or they produce very little amounts and need regular blood transfusion, or they become anemic if they don't have the regular blood transfusion. So, the main treatment, like I said, for thalassemia is regular blood transfusion. So thank you so much. This has now brought us to the end of this particular disease called thalassemia. Thank you. I love you so much. Remain blessed. Thank you. Bye. Love you.